We are a private, not-for-profit health system. We have a large academic medical center, over 900 beds in Greenville, North Carolina, and 7 community hospitals throughout the east of North Carolina, about a 29-county region. Our mission is to improve the health and well-being of Eastern North Carolina, so we take that very seriously.
We actually, over the last few years, have developed a robust system of patient and family-centered care advisors. They permeate our organizations. Those advisors are key in each of our councils across every unit, with our medical staff, even on our board of trustees.
Sometimes your preconceived notions are wrong. I mean, what you think that the patients and the families really want, what they really experience, and what they really know are not, in fact, the reality.
When we're sitting at a table, at a board table, looking at a patient advisor, those numbers become that person's face. And that has been very, very powerful.
Oftentimes the patients and their families are there, telling the story, telling us about, the things that went well, but we also, challenge ourselves to have them tell us about areas where we can improve. And that has just been phenomenal.
I think the board has paid attention to those anecdotal situations where you can talk about circumstances around a patient and it gets it off the paper into their minds and hearts.
Having them meaningfully tell us and be willing to listen to their feedback from bedside all the way to the boardroom is really important if you're going to take on this initiative, so that it has real meaning and that those advisors would say, I made a difference in that protocol, that process, or the way the hospital functions.
I think one of the major lessons is how simple a fix can be.
Almost after every patient encounter, we're receiving pointers and tips of what went well and what could be improved upon.
Before we'd see the numbers, but to actually have a patient there saying, I was one of these complications, and what are you going to do about it? And so to me, that is really helped drive the change that we have seen in our reductions in infections and serious safety events.
It's about the ability to get better. If you're an effective physician, if you want to be the best that you can be for your patients, for your own professional skill set, you must be receptive to that feedback. And it's about getting better with each encounter.
If we look at our quality and safety performance, we've had significant reductions, over 60% reductions in hospital-acquired infections. We're achieving, top 20 to 25% on patient experience surveys.
Very important thing is, as you involve patients and family in decisions, it's going to help lower your error rate. It's going to increase your satisfaction scores. So all the things that we're held accountable for will improve if you involve patients and families.